In part 2 of this series, I'll briefly review 3 important topics related to frozen shoulder. A common question people ask is, I can't think of anything I did to cause my frozen shoulder. How did this happen to me? Well, take comfort in the fact that others, many others, ask the very same thing. And we'll talk about that. The shoulder capsule is like a water-filled balloon that surrounds the shoulder joint. Have you ever seen those commercials where they put food or clothes in a plastic bag and then they suck out all the air? Well, the same principle applies to the capsule that surrounds the shoulder joint. When the shoulder is injured, the capsule can shrink wrap your joint. If you suffer from frozen shoulder, this drastically decreases your ability to move your shoulder. In fact, it can become very painful to even try. This limited motion in the shoulder frequently creates a fertile area for scar tissue to form inside the capsule and inside the joint itself. Scars inside the joint are often called adhesions. When you hear the word adhesions, think scar tissue. Research has shown us that when a joint is injured or functioning improperly, the deep muscles that surround that joint start to waste away. The muscles can become much smaller and much weaker very quickly. In fact, the muscles can become so much smaller that they appear to waste away. Now let me be clear about this. The muscle doesn't disappear. It just gets so small that it barely functions. The result of muscle wasting is that you feel pain and it makes your shoulder joint unable to hold a normal position. When this happens, you need to do specific exercises to rebuild these small, wasted muscles. And in fact, some of your pain may linger for years until these wasted muscles are strengthened again. Your bursa is a small sac filled with fluid. It acts as a cushion between tissues so they don't rub on one another. The term bursitis means that the bursa is inflamed. Bursitis, or inflammation of the bursa, is a common diagnosis, but many times it's not all that important. I'm not saying the bursa doesn't get inflamed. It does, and often. But the point to be made here is that if you have bursitis, it's usually as a result of something else. In other words, bursitis is not your problem. Cure the problem, and you cure the bursitis. Simple. I know this sounds ridiculous, but consider this. About 60% of people with frozen shoulder can identify a cause for the condition. For the other 40%, the cause is a mystery. But frankly, it doesn't matter what the cause was. Once you have it, the treatment is the same. Locate the involved areas of the shoulder and treat them with the appropriate techniques. One of my approaches to frozen shoulder is the Neil Asher technique. Frozen shoulder is a horrible condition. I know because I had it. And for my fellow sufferers, I will have a more in-depth presentation for you soon. So don't despair. There is hope. These techniques work exceedingly well for 90% of you. If you have shoulder pain, and especially if you suffer from a frozen shoulder, I strongly encourage you to visit the site frozenshoulder.com. It's among the most informative out there, and you can take a brief test online to discover which shoulder condition you probably have. The test is free, and the information is priceless. In today's world, we have much to do, and usually too little time to do it. This treatment technique fits into today's busy schedule beautifully. Only one treatment per week is required, and in fact more than that is too much. Between appointments, you must perform exercises that are appropriate for the stage of frozen shoulder you are in. Stage 1 exercises are completely different from Stage 3 exercises. The Neil Asher technique combines highly focused treatment sessions with a doctor and home exercises appropriate for your stage of frozen shoulder. This highly specific approach eliminates the need for multiple sessions per week. Do you suffer from shoulder pain that seems to be progressing or just won't get better? Do you find it difficult to comb your hair or fasten your bra? Does reaching for something in the back seat of the car cause you an exquisite twinge of pain in the front or back of your shoulder? Then perhaps you should consider an approach that combines soft tissue techniques with gentle, pain-free adjustments. This is the approach I take with my patients. Call and set up an appointment for treatment. I think it'll surprise you just how good it feels to feel good.